Thanks for staying with us. So Nigeria has the second highest estimated maternal deaths globally and accounts for one of the highest neonatal mortality rates in Africa. Joining us on the show is the Group Head Medical Operations, Bastion Health, Dr. Akinkunmi Ilori. He will be speaking on how Bastion HMO supports mental and child health. Welcome to the show, sir.
Welcome to the show. Good morning. Thank you.
So let's start with the HMO. Why is it so focused on maternal and child care health?
Thank you very much. So we understand that maternal health is a very interesting and delicate topic, actually, especially in this part of the world where we have a lot of maternal deaths. You know, you've mentioned those figures right now. So as at 2022, we had about 1,000 per every 100,000 deaths maternally, which is high, yes. I mean, the global average is about 300. By 100,000 live births. So seeing that this part of the world, Nigeria and most of sub-Saharan Africa, has about 3 to 5 times that. So it's very, very important that women all around the world, not just in Africa, have access to affordable and, of course, accessible maternal health care.
Okay. So, what would you say are the factors that are affecting the numbers that we have in Africa, and particularly in Nigeria?
Yes, so in terms of infrastructure, the infrastructure is just not there. We don't have what it takes. We don't have the equipment. We don't have the personnel. We understand doctors in Nigeria. Everybody's going abroad now for better remuneration, better lifestyle, and all that. So it's important that we're able to bridge that gap. So the major problem is we don't have enough personnel in this part of the world. We don't have the equipment, and of course, even in terms of enlightenment, in terms of knowledge of the people. You talk about low-income groups, vulnerable groups. They don't have that knowledge to be able to know what they need to access this kind of healthcare. So those are major factors that hinder people from getting the kind of care that they actually need.
Yeah, because most times you hear about mothers after having babies, they are depressed or they can't connect with the kids. So do you focus on that, on the mental state of postpartum stress for the mothers, and then mothers that are not able to have that connection with their children after they've birthed the child?
Yes. So we focus on the whole scope, starting from prenatal, starting from when the woman goes into labor, delivery, and of course, very important, the mental aspect of it all, postnatal. So we focus on all these things because we understand that it is a spectrum. It is not something that just focus on the woman. Okay, after you give birth, we leave you alone. We don't care anymore. So we have to make sure that even till 6 months, 1 year after the woman has given birth, she needs regular follow-up to ensure that everything goes absolutely well.
Yes. As an HMO, does your cover extend to private hospitals, and how the fees vary? Because it's a different fee if you were taking your treatment at the public hospital, and some hospitals vary, and the conditions of your pregnancy also is peculiar per person. So how does your HMO provide the cover?
Yes, so one of the advantages of being with Bastion HMO is that we have an extensive network of hospitals, both private hospitals and government hospitals. So you are free to have access to care in any of those hospitals. And we know that in terms of pregnancy, in terms of antenatal, women can be very attached to certain hospitals, to certain doctors, maybe because of, previous experience with these doctors and these hospitals. So it's important that we do not cut that attachment. So we have a whole extensive network of healthcare providers, maternal healthcare providers. And in terms of pricing, of course, it's important that the pricing, of course, is affordable. So in terms of health insurance, the enrollee, as we call them, people who are under Bastion are called enrollees, they do not have to pay anything most of the time. Most of the time, all the antenatal care, the postnatal care is covered by the HMO. So at least that comfort is there. They don't have to go through further extent financial hardship to be able to cover those costs, and minimal cost at all times with affordable healthcare.
So what if, some pregnancies require extensive care?
Yes.
Bed rest, some, preeclampsia requires some form of surgery and monitoring, and increases the fees.
Yes.
Is that a fixed fee, or, you can always, it's always wide enough for anything, any unforeseen?
No, so under the HMO, there are different plans that have different benefits and different coverage. So depending on the plan you buy, but even at the most minimal level, of your plan, you still have access to antenatal care with all the benefits that come with that. You have access to delivery, whether normal delivery or cesarean section, because we understand that there are actually some high-risk pregnancies that would need cesarean section, even if it wasn't planned. You know, you have elective cesarean section, you have the one that needs to be done immediately, emergency.
Yeah.
Exactly. So you might need to go in for an emergency CS. That is covered. We will not say because you're on the lowest plan, you will not have a cesarean section when you need to be. Our aim is to save lives and to give you the best care possible at any point in time.
So does the lower level plan, does it cover the baby checks after the baby has been born, vaccinations, or postnatal and vaccinations for kids, or does this thing need to, do you need to still come up the ladder to be able to have that access?
No, not at all. Even at the lowest level, you have access to all the vaccinations. You know, you have the NPI, Nigeria Program on Immunization, National Program on Immunization, which has the standard immunizations that every normal baby should have at any point in time. Of course, there are others that you may not get, but those ones are not the key ones that you have to get. You know, but even at that, we make sure that you get the key ones that you need at every point in time.
Okay, so, you know, with maternal care, sometimes, of course, it starts sometimes even from the family planning stage, you know, and many people, you know, you mentioned that there's a lack of education. Many people don't even know what they need to use, what options are available.
Yes.
Is your HMO able to provide people with the education and also the options that they need at that stage?
Of course, we do that at every level. We do health talks, you know, enlightenment programs, you know, campaign shows and all that. We do that at every level, even for males, females, non-pregnant people, you know, even at a young age. You know, we start young to ensure that that knowledge has already been embedded in that person, even at a young. We don't wait till someone is of childbearing age before we start giving those kind of, lessons or information. You know, it's important that they are faced at every point in time so that they are ready with that information. So at every aspect of their lives, we ensure that that knowledge is
So in picking an HMO, many people always like to look for track record. How long have they been around? Who uses them? I mean, how kind of clientele do they have? You know, so tell us a bit about Bastion HMO and why we should trust you to.
Okay. Yes, so Bastion HMO is about 3 years old now.
3 years.
Yes, started operations in about 2021. And I mean, in this short space of time, I think our services have been known to be one of the best in the industry. You know, from our staff management board, you know, have people who have pedigree in greater, even bigger health insurance spaces like Axomanside and the likes. So we have that within our board. And what we've done concerning our extensive network of providers, as I said, we have over 2,000 providers nationwide, which are the hospitals. When I say providers, I mean the hospitals, diagnostic centers, pharmacies, you know, optical and dental centers as well, all over the country. You know, we're in about 7 regions in the country at the moment, and we'll continue to extend and expand. You know, in terms of technology as well, we leverage technology as much as possible. You know, in terms of telemedicine, talk about telemedicine. A lot of people find it hard to go to hospitals these days. We understand the waiting periods in the hospital, you know, the overcrowding and all that. So from the comfort of your home, you can actually have access to speak to a medical practitioner and even have medications prescribed to you, and you can get those medications delivered to you as well. So in terms of technology, we are trying to ensure that we bring comfort to people. We say at Bastion Health that we are giving you health at your place, at your pace, and to be able to, you know, we don't rush you, and we want you to be comfortable when you access care with us. So
is there a way Nigerians can reach you?
Yes, of course. We are available on all the social media platforms, you know, on Instagram as Bastion HMO, on Twitter, on LinkedIn, and of course 0800 Bastion as well. Our contact center is open 24/7. You can always reach out to us. And on the mobile app, I must speak about that. We have a mobile app. Just go to the Play Store or App Store and search Bastion mobile app. You have access to see our list of providers.
Oh, fantastic.
You can register on the mobile app and be able to see your benefits and your limits as well.
Okay. Thank you very much. Pleasure. Thank you so much for wishing you all the best.
My pleasure.
Let's go on a short break now. When we come back, we continue with the show. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.